Hi, my name is Alexis Johnston. I'm here to do a head-to-toe assessment on you. I'm going to ask you to remember my name later on in the video. I just went and washed my hands. Can you tell me your full name?
Hannah Elizabeth Matter.
Okay. Your general appearance for your apparent state of health is healthy and vigorous. Can you tell me your age?
19.
Okay, and you're a Caucasian female. And can you tell me your height and weight?
5'8", 130 pounds.
Okay, you're in the healthy BMI range of 20. Your dress, grooming, and hygiene, everything seems to be appropriate. Now to test your mental status, your general demeanor seems to be cooperative from how you're responding. Your affect is animated, your thought pattern is logical, and your speech is articulate. Your level of consciousness is alert. Orientation, can you tell me your full name again?
Hannah Elizabeth Matter.
And where are we?
Steubenville.
Okay, and what day of the week is it?
Friday.
All right, good. So you're alert and oriented times 3. To test your intellectual capacity, for remote memory, who was the president before Trump?
Obama.
Recent memory, my name.
Alexis Johnston.
Okay, and to test abstract thinking, an apple a day keeps a doctor away. How would you interpret that?
A healthy diet equals a healthy lifestyle.
Okay, and for judgment, if it was raining outside, how would you prepare to go out?
Rain boots, a rain jacket, and an umbrella.
Okay, intellectual capacity is intact and appropriate. Now I'm going to get your vital signs. To go in order, to do your temperature.
Your body temperature is 97.3 degrees Fahrenheit.
So your temperature is 97.3 degrees Fahrenheit. And I'm now going to do your pulse. Okay. Okay, so for your pulse, I got 70, and your respirations were 16. So I'm now going to take your blood pressure. Okay, so for blood pressure, I got 112/62. Okay, so now I'm going to examine your head. So the shape is normocephalic. Everything looks normal. Everything is symmetrical. I'm going to assess your hair, okay, and your scalp. So you have brown hair, and I feel no lumps or lesions when palpating. Now I'm going to examine your eyes. Everything is properly aligned. Your eyes are aligned with your ears properly. Good. Prominence is good. I'm going to now do PERLA on you, which is pupils are equally round and reactive to light with accommodation. I'm going to have you look at the bridge of my nose, and I'm going to test your eyes. Okay. Okay, good. Now to test your accommodation, I'm gonna have you look at the wall behind me and then look back at my pen. Okay. Okay. Pupils converge and constrict properly. Okay, so now I'm going to test your EOMs. I'm going to take you through the 6 cardinal fields of gaze to test your cranial nerves. Okay, follow my finger. Okay, good. So that tells that the cranial nerves 3, 4, and 6 are intact. Okay, now for your ears. Your ears are symmetrical. I don't see any lumps or lesions. I don't see any redness or discharge in either of your ears. Are you having any trouble hearing today?
No.
Okay, so gross hearing is intact. Okay, now I'm going to check your nose. Are you having any congestion? No? Okay, good. No drainage. Are you having any difficulty with breathing?
No.
Okay, any difficulty smelling?
No.
Okay, breathing and smelling are both grossly intact. Okay, I'm going to look now for your throat. I'm going to look in your mouth. Okay. Everything looks pink, moist, intact. I did not see any lesions. Are you having any trouble with your teeth? Any loose teeth? Okay, I didn't see any missing. I saw no dentures. I did not get an odor off of your breath. And can I have you swallow? Okay, good. Swallow was positive. Now I'm going to test your tracheal alignment to see how it's aligned with down to your sternal notch. Okay, everything was good there. Everything was down symmetrical down to your sternal notch. All right, so I'm going to assess your lymph nodes now. I don't see on inspection, I don't see any lymphadenopathy. So I'm going to palpate your 10 chains of lymph nodes. Okay, so pre-auricular, post-auricular, occipital, submental, submandibular, tonsillar, superficial cervical, deep cervical, needing that, back to your posterior cervical, and your supraclavicular. Okay? All lymph nodes were non-palpable. Did you have any tenderness with that or any pain or anything?
No.
Okay, good. Now I'm going to check your carotid. I'm going to do one side at a time. So I'm going to go to your Adam's apple, 2 fingers down. Okay, good. Strong. 3+. I'm going to check the other side. Okay, good. 3+. Now I'm going to listen. I'm going to auscultate both sides for any bruise. Okay, I'm going to have you turn your head to that side. Okay, that side. Okay, good. So, negative for bruise. I heard no turbulence. All right, so that is all for the carotid. Now I'm going to go onto your skin. From what I can see, everything is the appropriate flesh tone. I don't see any lesions or anything. Moisture is good. It's not dry or wet, it's appropriate. Okay. Texture was smooth. Temperature, everything was not hot, not cold, which is good. Going to test turgor. Going to pinch an inch, and it should go back. Good, good turgor. And like I said, I see no lesions. All right, now I'm gonna have you lay down for the heart assessment. Okay, so now I'm going to assess your heart. First thing that I'm gonna do is gonna see if there's any visible pulsations. I'm gonna get eye level with your chest. Okay, negative for visible pulsations. Now I'm going to palpate each site on the heart for pulsations and thrills. So first I'm going to start with your sternal notch, and move over to your second right intercostal space at the aortic. Okay, negative for pulsations, negative for thrills. Over to the pulmonic site, negative for pulsations, negative for thrills. Erb's point, negative for pulsations, negative for thrills. Fourth intercostal space, negative for pulsations, negative for thrills. Fifth intercostal space, negative for pulsations, negative for thrills. Now test the PMI. Okay, I'm getting a light faint tapping for the PMI, which is good, appropriate for the vital signs, appropriate duration. I'm going to test for thrills. Thrills are negative, good. Okay, so now I'm going to auscultate to test the appropriate relationship of S1, S2 for your heart sites. Aortic. Okay, pulmonic. Erb's point. Fourth intercostal space. Fifth intercostal space. Baby step. And mitral. Okay, good. I heard no extra heart sounds. Everything sounded good. I can have you sit up now. So for all of your sites, the rate was consistent with vitals. The rhythm was regular. Strength, the intensity was strong. Like I said, negative for heart sounds. If you did have any extra heart sounds, I'd have to listen through again, but you were negative, so everything is good. Okay, so now I'm going to assess the anterior of your thorax. If I can have you scoot over here. Based on inspection, everything is symmetrical, is appropriate size. I see no barrel chesting. No deformities are present. I'm going to palpate your shoulders, your clavicles. Okay. Everything is symmetrical. I'm going to palpate down your sternum. Okay, sternum is good, vertical. Everything on the interior looks good. I'm going to have you turn your head so I can test your respiratory excursion. Okay, I'm going to take a deep breath. Okay, one more time. Okay, good lung expansion. Your respiratory excursion was deep and symmetrical. Now I'm going to look for any lesions. All right, lesions are negative. Now I'm going to auscultate the front sites on your lungs. Okay, I'm going to have you breathe deeply through your mouth, but no quicker than normal. I'm going to have you turn your head. Okay, good. Everything sounded good. Rate was consistent with vitals. The rhythm was regular. Depth was deep because I asked you to breathe deeply. Effort was non-labored. I saw no use of accessory muscles. So use of accessories was negative, and I heard no adventitious breath sounds. Okay, good. Now I'm going to assess the posterior thorax. Okay, so first I'm going to palpate your scapula. Okay, good. Everything is symmetrical. Can I have you give yourself a big hug? Yeah, everything is good. Now I'm going to palpate down your spine. Okay. Spine is vertical. From what I'm seeing, there's an appropriate S curvature of the back, so that is good. Your here, can I have you release your arms? Your AP diameter, half of your transverse, so that is good. Lateral distance is half of the back. I'm gonna do respiratory excursion on your back now. I'm gonna have you take a deep breath. Ready? Go ahead. Okay, respiratory excursion on the back was deep and symmetrical. All right, so now I'm going to auscultate the sites on your back. I'm going to have you breathe deeply through your mouth, but no quicker than normal. And move your hair. Okay. Okay, you're good. I can have you turn around now. Okay, your rate on your posterior lungs was good, consistent with vitals. Rhythm was regular. Depth was deep as you were breathing deeply. Effort was non-labored. I saw no use of accessory muscles, and adventitious breath sounds were negative. Okay, so now I'm going to assess your abdomen. If it's okay with you, can you just lift your shirt up a little bit so I can see your abdomen? Okay, good. So based on inspection, I see no pulsations and negative for distension. So for auscultation, I'm going to listen in one quadrant for 1 full minute to find the number of gurgles. Okay. Okay, good. So the number of gurgles that I heard in that 1 minute was 19. So that's normal active bowel sounds in the range of between 5 and 34. So that is, everything is good. Now I'm going to percuss in a lap around your abdomen. Okay, good. Heard tympani all the way around. That's good. Now I'm going to palpate through your abdomen. Okay, good. Do you have any tenderness with that?
Mm-mm.
All right, good. I did not palpate any lumps, no enlarged organs, so that means no organomegaly, and your bladder was non-palpable. So based on inspection and palpation, there was no abdominal distension, and the abdomen's contour is flat. Okay. Next, I'm going to do musculoskeletal, so I can have you sit up. I'm going to ask you a few questions. So, are you having any joint pain anywhere?
No.
Okay, any stiffness or anything like that? All right. So everything looks to be symmetrical. There's no deformity in the bony structure from what I can see. Are you having any difficulty? Can you move your joints and everything?
Yep.
Okay, good. Carpet, whenever you're moving your joints, do you notice any crunching or anything like that? Okay. And look at extremities. The color is good. Upper and lower extremities, color is good. Temperature, I'm gonna use the back of my hand. Okay. Appropriately warm, everything is good. I'm gonna test your pulses bilaterally. I'm gonna start with your radial pulse. Can I have you take off your watch? Thank you. Can I have you? Good. Radial pulses are present, bilateral, intact. I give it a 3+. Now I'm gonna do posterior tibialis. Okay, pulses are strong, 3+ and symmetrical. Now the dorsalis pedis. Find the great toe tendon. Good. Pulses are 3+ and symmetrical. So now I'm going to test your capillary refill. I'm going to do 3 of your fingers. I'm going to start with your thumb. Blanche. Should come in under 2 seconds. Good. Okay. Upper extremities, brisk capillary refill. Lower extremities. Okay. Lower extremities, brisk capillary refill. Okay, so there's no evidence of edema. I don't see any edema. Now I'm going to test your neurological, test your strength. I'm going to cross my fingers. I'm going to have you squeeze. I'm going to have you push. And I'm going to have you pull. Okay, good. Upper and lower extremities bilaterally are strong and intact. For coordination, I'm going to have you stand up and walk across so I can look at your gait and posture. Okay, you can come back. Okay, gait was coordinated and smooth, no ataxia, and no imbalance problems. Sensation, are you having any sensory problems? Any problem with hot, cold?
No.
Any pain? Okay. Are you having any problems other than that?
Nope.
With sensation? Okay. Now I'm going to test your deep tendon reflex. I'm going to start with your bicep. I'm going to use my stethoscope. Can I have you make a muscle? Okay, relax. Okay. Do it one more time. Relax. Okay. Do the other side. If muscle. Relax. Okay, good. Muscle contracted. All right, now I'm going to do your patellar. Okay, I'm going to tap your my stethoscope on your knee. Okay. Okay, good. Reflexes are bilateral. They're 2+, both upper extremities and lower extremities. They are both intact. To test your short-term memory, for the last thing, can you tell me what my name is?
Alexis Johnston.
Okay, good. Thank you for being my patient today.